Hi, I'm Dr. Stephanie Dunlap at UC Health University Hospital. I'm the medical director of the Advanced Heart Failure and Mechanical Circulatory Support Program. We worked with the Greater Cincinnati Health Council and the Robert Woods Johnson Advancing Health for Quality initiatives to lower our heart failure readmission rate. To address this program, we formed a multidisciplinary team comprised of nurse clinician educators, nursing managers, pharmacists, chief residents, and outpatient heart failure nurses and nurse practitioners.
Hello, my name is Mary Collier. I work at UC Health University Hospital. I work in the cardiology division. Together, we worked as a team to design a program that we entitled Your Heart's Connection, and this program provided resources and materials for our patients.
In our Advanced Heart Failure Initiative to decrease the readmissions, we decided that one of the principal reasons that patients got readmitted was lack of knowledge about sodium in their diet and how it could re-affect them with getting admitted to the hospital over and over again. We designed a team called Your Heart's Connection, where nurses introduced themselves during the hospital admission and then educated the patient about their medications and about their diet. After discharge, these nurses on Your Heart's Connection team called the patients around 2 to 3 days after discharge to make sure that they were taking their medications, that they knew what their medications were, and to reinforce the necessity of maintaining a low sodium diet at home.
The phone call was very important as it enabled the patients to ask any questions that they may have thought of after they got home. They were also given a telephone hotline that they could call and get hold of a nurse during business hours to ask any questions.
Additionally, we made sure that the patient had a follow-up physician appointment or a nurse practitioner appointment within 7 days of discharge. We also designed a special order set so that the patient would be on a 2-gram sodium diet in the hospital, a fluid restriction, and would have a social work consult, a dietary consult, and a financial aid consult to help them with any potential problems that they might have.
We designed all kinds of educational materials and resources for our patients to best take care of themselves. We designed intake and output sheets that they could log their fluid in and fluid out. We designed diet menus with recipes to help them be able to cook with a lower sodium and make better choices within the grocery department. We provided them with 2 weeks of medications if they needed that, if they met our qualifications, and also a scale to weigh themselves if they didn't have one available to them. We enabled the nurses to provide the patients with the information and the actual material that they needed. The nurses were able to use the teach-back method to ensure that the patients understood the information.
If we were going to give other hospitals or physicians advice, we would advise them that calling the patient following discharge 2 to 3 days afterwards would be of utmost importance, as would having an appointment within a week following hospital discharge for heart failure. In this program, since we started it, our readmission rate was 28%, and it is now down to an average of about 22%.
We were able to then go to our administration and show them our data, and they have since hired and have 2 heart failure coordinators to support our patients.